and welcome to the Motorsport Coaching Podcast, sponsored by Motivate Training and Management. This is a podcast where we talk to drivers and industry experts to help you maximize your performances on and off the track. Let's get started with today's show. Hey crew, welcome to episode 123 of the Motorsport Coaching Podcast. I am your host, Belinda Risley, founder of Motivate Training and Management. This week I've got something a little bit different for you. We're talking to Katrina Robertson. Before I get into her intro, I'd just like to remind you we've got an upcoming webinar which is live and free next Tuesday, August the 2nd, starting at 7 p.m. Australian Eastern Standard Time, with the topic being 10 things you can do now to help you gain sponsorship. If you'd like to register for that free event, please head over to the show notes or race over to motivatetraining.com.au/capital W, capital S, capital W. Unfortunately, it does need to be in capitals in order for it to work. Lesson learned. Also, the link will be in today's show notes. Of course, if you cannot make it, the recording and workbook will be available after the event. So if you're interested in around how you can gain sponsorship right now, please race over and join up for our webinar. So team, today we're going to be talking to Katrina Robertson. She's a qualified sonographer and radiographer with over 14 years experience in the field of medical imaging. In 2017, Katrina decided to pursue her entrepreneurial passion and open her first medical imaging practice specializing in ultrasound. In 2019, she grew that business to a second site, and she's conveniently located near Bathurst, near our famous race track. So thanks to her multiple university degrees and industry experience, Katrina has a thorough understanding of a range of pathologies, their symptoms, and their imaging appearances. In today's episode, we're going to be talking about the role of ultrasound and pathology, the role that it plays with period pain, endometriosis, bursitis. Hope you enjoyed today's episode. Don't forget, if you haven't listened to last week's episode, we had the wonderful, talented Gwen DeSalle, episode 122, talking about her track to the Formula One. It is an inspiring story, and I hope you enjoy today's episode as much as I do. Hi, Katrina. Welcome to the Motorsport Coaching Podcast.
Thank you for having me. I'm excited to be here.
Yes, well, your story and career is a little bit different. We've never had anyone like you before on our show, but I'm very excited to hear your story. So tell us a little bit about you and what you offer.
Yeah, so I'm a sonographer. So I studied medical imaging at university. So I did radiography first, so X-ray, CT, all those sorts of things. And then I went on to do a postgraduate degree in ultrasound. So as you sort of think, the first thing that you'll think about with ultrasound is pregnancies, but we do a wide range of ultrasounds. So as far as motorsport goes, we ultrasound all the injuries that come along with accidents, and even just the general wear and tear of driving that it puts a lot of strain on the body. So we deal with all that sort of stuff. I started my own ultrasound practice back in 2017. So I branched out on my own and opened an ultrasound practice then, and expanded the business in 2019 to a second practice. So yeah.
Fantastic. Why radiographer?
Yeah, so
did you break a lot of bones over your years and went, hey, you know what,
happily not a lot, but funnily enough, the deciding factor was that I broke my finger. I fell off a horse, and it's either horses, motorbikes, or race cars, right? And broke my finger and had to have an X-ray, and was talking to the radiographer. And at the time, my mum is a nurse, so I wanted something in the medical field. Didn't really want to spend all that time at university to be a doctor. Yeah. Ironically enough, though, in order to do the 2 degrees, I've pretty much spent that much time at uni anyway. And didn't really want to go down the nursing route. And yeah, medical imaging was a good sort of middle of the field that you got all that patient care, but it was a really interesting field too. Yeah.
And not only do you do those roles and have two businesses, you are a young mum as well.
I am, yeah, yep. So I've got a 1-year-old.
Yes.
So yeah.
Yes, like you can relate to some of the mothers that we have, the parents are of the athletes, having to juggle all those things like working full time, businesses. A lot of the parents do have small businesses that they're trying to run as well. How do you go about juggling your life at the moment?
Yeah, so support definitely helps. So family and friends that are there to help when needed. A bit of here, can you have my little one for a few hours while I go and do this, or lots of preparation too, I guess, is the other big one. A lot of pre-planning.
Yes,
Yeah.
That's with
Yes.
everything, isn't it? Just like with everything. Whether you're running a small business, whether you're running a race team, or just trying to be a parent, just plan.
Yeah, and don't worry too much when nothing goes the way you plan.
No. So back to ultrasounds then, so right onto the business side of things. So you're talking about being able to help the athletes with the injury side of things. Can you talk us through like the ultrasound process?
Yeah, absolutely. So generally what will happen is that you'll go to your doctor first, and they'll do a physical assessment and sort of have an idea of what they think might be going on. From there, they'll decide what the best imaging will be, whether, if they think you've broken a bone, whether you just have an X-ray or a CT scan. If they think that you've torn your muscle or your ligament, tendon, then they might do both an X-ray and an ultrasound.
Mm-hmm.
A next step tends to be an MRI as well, as for those sort of soft tissue structures.
Mm-hmm.
So they'll decide what they think is going on and what the best imaging will be to see. And then they'll give you a referral, and you'll call your local medical imaging practice and say, I need a X-ray, CT, something, ultrasound of this particular area. Let's say it's a shoulder. So I need an ultrasound of my shoulder. And then you'll come in for your ultrasound. And for generally, if you're having both an X-ray and an ultrasound, we'll do the X-ray first. It can give us a good idea of what we might find on the ultrasound. So we can have a look. If you're torn, if you tear your tendon away from the muscle, or from the bone, if you tear the muscle away from the bone, then it can take some of the bone with it. So this will give us a good indication that there's something going on. And so we'll have a look at the X-ray first, and then we'll bring you in for the ultrasound. Depending on where we're looking, you might need to get changed so that we can get to the area. So if it's your shoulder, you might get changed into a gown or something so we can get to your shoulder. And we put some, at my practice, some warm gel on your shoulder. In other places it might be cold, but we put some gel on, and then we use what we call a transducer. So it's like a camera, a little probe that we put on the skin, and it produces sound waves. So just like we're talking, but they're a lot high frequency, so we can't hear them, but they move through the skin and through the layers of tissue. And depending on how dense a structure is, it'll send the ultrasound wave back to us. So bone is really dense, so it sends all the ultrasound back to us, but the soft tissue will only send a little bit. And the ultrasound machine collects all this ultrasound wave information back, and then it turns it into a grayscale image. So we get a picture out of it, which shows us the inside. Yeah. And so from there we can interpret the images and decide whether there's anything going on, and see those sort of muscle, tendon, ligament tears, any bony damage. This is more just in our soft tissue, so in our muscles, but in other areas of the body we can see other things as well. So we can assess for all of that, and then we write up a sonographer's report for the radiologist. So it's a doctor that specialises in radiology. The radiologist will write their formal report, so they get to make the final call as to whether there's anything going on or not. they'll write their report and they'll send it back to your doctor, and then your doctor will have a look at the report as well as all the other information they've got. So they'll have information on blood tests and any other imaging you've had. They might know that you've previously had a break of your wrist or something else. They'll have all that information. They'll put it all together, and then from there they can figure out what's actually going on and then come up with a treatment plan. So from there they might decide that you just need to go and see a physio or something like that. So they'll decide from there what the next step is.
Beautiful. And can you use like ultrasound for a preventative measure? So we're just talking about after the incident and to see if something's torn or something like that. But if you've got a niggle, can you kind of use it in a preventative way?
Yeah. So generally when we think of medical imaging, we think that you've had an injury, but a lot of what we'll see is just general sort of wear and tear. So something you might have heard of is bursitis. So it's the bursa itself is a lining around different structures. So generally it'll be either in between ligaments and muscles or ligaments and bone. And the whole point of the bursa is to make everything slide smoothly. So if we're doing something that our body doesn't like, and it can make that bursa become inflamed. So the whole area gets a bit upset. The bursa will get thick. And when it gets thick, everything just sticks together. It doesn't slide like it should. And then that will cause you pain. So if you've got little niggles, but you haven't had an injury, then quite often that can be what it is. So you can have an ultrasound, and then from there they can say, oh, no, there's no tears or anything going on. But as a preventative measure, we want you to see a physio or something like that and make sure that we're reducing whatever it is that the body doesn't like so that everything moves well together.
Yeah, so as a preventative measure at the track, Motivate actually has a tent. So we have a massage tent where we have sports massage therapists. So if anyone throughout the race weekend does feel any niggles or any tightness, they do come and have a massage, or they can have an assessment for a referral. So sometimes we do have osteos as well as physiotherapists within those tents. Most of them are sports massage therapists, but at times we have referred them on to actually go and get some further treatment or get some further investigation with the ultrasound to make sure that there's nothing torn, especially after an incident has occurred. If someone does, I mean, in karting, one of the most, when an incident happens, it's my diagram for you, like the car goes off the back of someone's shoulder. Do you recommend that they go straight to see an ultrasound, or do they have to be referred via their GP before coming to see someone like yourself?
Yeah, so they'll definitely need to go and see their doctor first. Yeah. Some physios will be able to refer for x-rays. Generally, they won't be able to. Some can refer for an ultrasound as well, but Medicare won't pay for it. So they can, if they've got into their physio first, they can get referrals. But for a Medicare rebate, they'll need to go to their GP. But it's definitely worthwhile getting in there first. The other thing with those sort of niggly bits where there's nothing torn, but a good massage and some stretches can do the trick. If they have a bit of inflammation, then quite often they'll, depending on the age of the patient as well, they'll do a steroid injection or a cortisone injection, which the whole purpose of that is to reduce the inflammation. So quite often if they do the injection, then you can have physio on it because the pain's gone, so you can move a lot more easily. Whereas if it's all really inflamed, then it can hurt quite a bit to do those stretches. So that can be another good thing too. If there hasn't been an injury, but it's just a bit sore, and it's not getting, it's a bit too sore to do the stretches, and it's not really getting better, then that can be a good way to go about it too, as a preventative maintenance. That it can make your massage and your physio work a lot better.
Awesome. So you are located near our great track, Bathurst. Very exciting because we have lots of major race meetings out there. It's most
absolutely
in the world. So yeah, we've got the Bathurst 1000 coming up. So of course, like if anyone's needing some assistance, get a referral from a doctor. But obviously at the track, they can get a referral to come to you to come get some treatment over the course of that week.
Yeah, yeah, definitely.
In October.
Yes, no, so it's coming around awfully fast at this rate.
I know. It's very scary.
Yeah.
Hesitate when the date was, where we are.
Yeah, I'm not sure how we're already halfway through the year or more than halfway through the year.
I'm starting to freak out because they're already starting to post so many weeks to Christmas, on social media. I'm like, no.
It's just not fair.
So apart from injury prevention, Katrina, you also mentioned about women's health. Obviously, pregnancy is the first thing that we think about when it comes to ultrasound. How else does ultrasound or work with women's health?
Yeah. So
lots of lady drivers and pit crew and officials and volunteers.
yeah, absolutely. So basically anything that you think about that we tend to deal with women's health. So period pain, sort of lumps and bumps, all of those sorts of things that as well as pathology that may not have symptoms that we get straight away. So like ovarian cancer and uterine cancer and those sorts of things. So we deal with all of that. One of the big ones will be period pain. We quite often have women come in with those symptoms, and sometimes it is just your cycle, but a lot of the time there'll be an underlying cause for it or something that can be done about it. So sometimes that can just be that your cycle's just really heavy, really painful, and they might look at doing things like the contraceptive pill or a Mirena, so intrauterine device inside the uterus to control hormone levels, so that you're not having that cycle as you normally would, so that you're not getting that pain. They're generally the two things that they'll tend to go for as far as pain management when there's nothing wrong. So quite often they'll do the ultrasound first to just check that there's nothing before they go on and do something else to control that pain. You might also have a really heavy flow, and that can definitely get in the way of your race meetings and things like that. That's the last thing that you want. It's definitely going to, impact your day, and something that medically we can get around if need be. Something else that's quite often a cause for quite bad period pain or just pelvic pain in general will be, you might have heard of endometriosis. So what happens with endometriosis is that the lining of the uterus basically gets outside the uterus, so where it shouldn't be. It can attach to the ovaries, the bowel, the bladder, the general places that it attaches to that it shouldn't be. And when we get our period, like the lining of the uterus does, the parts that have gone outside the uterus that shouldn't be there, they bleed too. So that's why women with endometriosis get so much pain, is because the endometrium that's outside of the uterus is also doing that process as well. So you're getting that inflammation and bleeding outside around your ovaries and bladder and bowel. So for those patients, we do ultrasound as well, because in some cases, in severe cases, we can pick that up on ultrasound. If they're getting chronic pain as well, then it could be that the endometriosis has got so bad that it's actually caused everything to sort of stick together. So we use ultrasound to see whether things move as they should. So there's some things in women's health that we tend to look at. As far as women's health goes as well, we also do quite a few breast ultrasounds is the other area. So for just screening when you don't have any symptoms, then mammograms are the best way to go for screening. They'll pick up something along the lines of 95% of breast cancers, because those particular breast cancers all start with calcification. Mm-hmm. But for those other 5% of breast cancers that don't start with calcification, ultrasound will pick them up first. So for screening, I like to do both of them to cover all of our bases. But so if you're over 50, or if you've got a family history, then generally 10 years before that family member who was diagnosed, then we tend to start screening in those groups. Or if you've got a lump changes in your breast, pain, anything like that, then we do ultrasound for those as well.
And with the women's health, Katrina, do you still need to go through the GP to get the referral to yourself? Or is that something that they can still come to you and go, hey, I felt something, can you have a look before I go to my GP? Or is it still?
Yeah, still through your GP.
Yeah. No wonder our GPs are always busy when they could just come in straight to you. Take out the middle.
Exactly it. Yeah, exactly. Generally, it is through your GP first. There are some places that have set up different sort of women's health clinics that you can go straight there and get everything done in one go. So I know there is a place in Albury, and that's how they work. That I think they must have a doctor on site as well. So you go and kind of book into their women's health clinic, and you can get everything done while you're there. So you can see the doctor, get the referral, and then go straight in and have your mammogram or have your ultrasound or whatever it is that you need. So they've got it set up that everything's just in the one place. But in general, you'll need to get a referral first.
And are you located near a doctor or within a doctor's practice? Or?
Yeah, so we're sort of down the road. We're on the main street, so we're about a block away from the doctors. So it's still nice and close.
Yeah, and just so you know that there are actually two ladies, one in Albury and one in New South Wales, doing a PhD around period pain and motorsports, so injury and the effects of that. And another one is doing it around about breast tissue and the impacts of crashing and what that plays and the effect of going forward. Like, does it bring on any deformities or anything like that? The effects it has on breastfeeding. And so there's some research coming out around that aligned specifically with motorsports. So I'll send it to you when it comes out.
Yeah, thank you.
Yeah, because they're really big topics. And as I said, women in motorsport is definitely a growing area within motorsports. But of course, I know there's a lot of, I guess, again, team owners and just around about period pain. Again, falling pregnant was, becoming a driver as a profession. All of these concerns around all of these health issues that potentially could come up. No different to what a guy could obviously get. They have their own spectrum of illnesses as well, but I definitely know it's more of a talking point around women in motorsports, definitely around period pain and performance, dealing with endometriosis, again, just even having a crash and the impact on our pelvis, on our breast tissue, all of those main areas that, fertilization and baby carrying, and then there's like women that don't even want to have kids, so it's not even a plain fact, but of course it's all part of the bigger picture of trying to get a better image of what does a woman in motorsport look like.
Exactly, yeah, and the more research that's done, and the more we look into it, the more we shine a light on it, will help women in motorsport and get people into motorsport if they've got those answers. So that's brilliant.
Fantastic. Well, thank you so much, Katrina, for sharing that insight into ultrasounds and x-rays and injuries, preventative bursitis, and that endometriosis, which I know is a very big, again, subject for a lot of women out there. So thank you for sharing your knowledge. Again, if anybody's up and around the Bathurst area and is requiring some imagery, please contact Katrina at KLR Medical Imagery. And yes, and Katrina's details will be in today's show notes. Otherwise, are you on LinkedIn? People can have a chat with you there.
I am on LinkedIn, yes. Yep. So I'm my personal profile's Katrina Robertson on LinkedIn.
Beautiful. Well, thanks again, Katrina, for joining us. Everyone stay safe and we'll speak to you next week.
Thank you. Bye.
Well, thanks everyone for listening to this week's show. I really hope you enjoyed that one as much as I did. Now, remember, all the show notes with the links and the specials mentioned in today's show are available over at motivatetraining.com.au. If you haven't already, I'd really appreciate it if you could head to iTunes or Stitcher, type in Motorsport Coaching, subscribe, and leave us a review. Each week, I'll read them out and you'll go into monthly draw to win a fantastic prize. If you have any questions or comments, please email us at motivatetraining.com.au or head over to our Facebook page at Motivate Until next time, take care.